Hi, I'm Dr. Julie Steinauer, and today I thought I would redo a video that we've done in the past. It's been super popular talking about strabismus and why you don't need to have strabismus surgery. Alright, so I've got my handy dandy ball here to simulate the eye. And what you want to know about how muscles attach to the eye is that we have some that come in from the top, the bottom, each of the sides, and then also on the diagonals. So the way that your eye will rotate is it can rotate up and down, obviously, in and out. Okay, but we can also rotate kind of like at the diagonals. When a person has had strabismus surgery, typically what they're doing is one of two things. They're either lengthening one of the muscles or they're resecting it, which means that they cut a section out of the muscle and then reattach it as a shorter muscle together. Now what this does, if we have an eyeball that's turned in and we take a section or a resection out of this muscle, is it pulls the eye out. Here's the problem though. When those muscles get kind of like the section up at the front and the section at the back get reattached, there can be some issues in terms of how they're attached back together, so that instead of bringing the eye straight out, we might actually overcorrect and bring the eye out too much, or it might actually tilt up and kind of diagonally come out just a little bit. So then we have a new type of strabismus, either out or on the diagonal, which is called a cyclostrabismus, and those are really tricky. The more surgeries that you have then to try and correct the areas and problems of eye turn, the more you have contracture of muscles, because these muscles will scar tissue down after the surgery has taken place. And then that can pull the eye in a lot of different directions. So it's not uncommon to see that we would have now an upward cyclo-deviated eye at kind of like, almost like at a diagonal angle. And as you can imagine, that just sounds like a mouthful. And it is a mouthful. It's also a huge problem when it comes to the eye, because now the brain is not sure where the eye is aligned and it doesn't know what to do with that eye. So why don't you need surgery? Well, because there's functional ways that you can actually correct this. See, the control center for the eye is actually the brain. And so when we need to change what the muscle is doing, if we just tell the brain what it needs to do, we can signal to the muscle something different and align the eye differently. This is what vision therapy is all about. It's like training the brain and the eye to do together what it needs to do. It's not about cutting a muscle, or it's not about lengthening a muscle. It's about making the brain the better control center for the eye itself. So for more information about how we do vision therapy and what that does for strabismus, you can certainly watch more of our videos, but you can also go to our website at visionforlifeworks.com. Thank you.